I'm Dean Walker, and welcome to the Poetry of Predicament podcast, a podcast for people brave enough to face humanity's challenges and problems, and most importantly, our numerous predicaments. The Poetry of Predicament is a podcast meant to inspire us to bring forth grace, beauty, and connection with the web of life in the face of a predicament-laden world. This week on the Poetry of Predicament podcast, we're speaking with Dr. Rose Kumar, who is decades ahead of her time in terms of creating an alternative healthcare delivery system in her community. And we get to speak with her about elements that are so very current for us now, like COVID, and about what are the elements that need to be in place for people to have a far more empowering healthcare delivery system. Dr. Rose Kumar. All right, welcome back to another episode of the Poetry of Predicament podcast. I'm very excited. Today just seems to be a day of synergy, of remarkable conversations, one after the other. And this one in particular with Dr. Rose Kumar is one that I've been looking forward to for a while. Dr. Kumar and I have been in a conversation group. I don't really know what else to call it. We choose particularly pointed and charged topics and deep topics to look into, a small handful of us. And every one of those conversations has been so juicy. You know, everyone in there is doing some remarkably refined sense making and then contributing that sense making into the conversation. And that's rare these days in my experience. You know, we're living in times where whatever the opposite of sense making is present and likely taking us down, if I can add my cynical punctuation to that sentence. So Dr. Rose Kumar, Rose, it's just great to have you here. Our conversations in that group have been so nourishing and yet a little bit spicy, a little bit cynical, and well, as long as I'm there. And it just seems like just before hitting the record button here, you and I were talking about what it's like to just bump into someone with whom there's resonance, this kind of deep resonance. And we both were expressing our version of appreciation of when that happens. And I truly feel that that's happened every time I've connected with you on those other calls, and now that especially that you're here. And I'm so glad that you're here. And I just want to take a few moments to speak about why particularly I wanted you to be here. I mean, first off, you're just a perfect fit for someone who clearly has something to say about what we're facing at the global scale, all the way down to the most intimate or community or neighborhood or familial level. And particularly what has gotten my attention numerous times when you bring it up, when you're checking in the other group, you're sharing about your own alternative medical practice, which you've been in for decades, and you have an extraordinary track record with creating a different and what sounds to me like a far more empowering and empowered view on health and healthcare delivery. And we just started to talk a bit about some of your frustrations of the people some of the people that you interact with in your practice and out in public life. I think I was hearing, that certainly is the case for me, that there is such an extraordinary environment that I've never experienced at this scale before. And that environment is including things like, words that I would use like insanity. I really feel like there are strong waves of insanity that are washing through particularly the USA, where we have this awful combination of a propagandized public narrative that's gone on for years to twist us into the shape that we're in, and we're reaping the kind of dark benefits of that, uh, in terms of politics, in terms of corporate domination, in terms of paranoia, in terms of just twisted inability to think cogently in people. And I guess the last thing I would say is I'm also just noticing what seems to be the shredding of the last remnants of not only democracy, but a sense of communitas, a sense of a shared level of community that when I was growing up, there were still pretty noticeable, palpable areas of it. There was some way that people could talk with one another from different political stances. There was some sense of not nationalism, but actually we can set aside our differences and stand together as Americans in this special case, and so on. And I consider us to be absolutely incapable of doing that now. So I know I'm laying out a lot. We don't need to cover 90% of it. I just wanted to give the listeners a chance to know what sparked me, and what sparked me in your comments in our other conversation group were the combination of your medical expertise and your obvious skill at sense making from your own perspective and history and cultural background and so on, and professional background. And so I'm most interested if we could start, well, after, please, I'm hoping you'll introduce yourself and let us know how you'd like to be known in that way. I'd just love to hear you start us out in the direction of what is going on. What are you experiencing as someone on the front lines of healthcare delivery in terms of some of the issues that I brought up, and any others that you find, really worth talking about. So Rose, thanks so much for spending time. I'm really looking forward to this. And, again, just welcome. And if you would just start out with telling us a little bit about who you are and what you do and what matters most to you, I'd appreciate it.
Well, first, I want to thank you, Dean, for having me here. And it's a huge honor and privilege to have this authentic conversation with you. And I share the same sentiments about you as you shared about me. So, resonance is powerful. And when people are serving something larger than themselves and they come together, it's very sacred. So thank you.
Yeah,
just to give you a little background of who I am and what I'm doing on this planet is my name is Dr. Rose Kumar, and I'm my first real name is Kalpana, Kalpana. That is my Indian name. Kalpana means imagination, and I'm not sure my parents really knew what I would be imagining in my life. But here I am, 60 years later, still imagining a better healthcare model, a better way of delivering medicine, a better way of living as a physician in community with patients, and and really creating community. And what I did, I think it was a vision I had. I always came in saying, I'm going to be a doctor and no one's going to stop me. My mother always said that to me, that this is what you said when you were little. And so there was a driver inside of me, the self, which really held that vision through a lot of trauma that I've experienced in my life and a lot of loss. And I kept coming back to this place, this inner place of what is the meaning of this? Why do I have to go through this? And there is that term, the wounded healer, or a healer or a healthcare deliverer can only empathize if they've been through hell and back. And so it was, I think, a lot of initiations that I went through so that I could become real, if you will, and be able to sit with patients and people in a space that was more authentic and empathic and truly compassionate. So I think that, you know, a lot of what I've learned in nearly 4 decades of medicine is that the space we hold for our patients is probably the most powerful thing we offer them as we witness their lives and their suffering and what they bring to us in that sacred space of the exam room. And so when I was first started out, I was a 30-year-old fledgling, and I was a new mom, and you know, wanted to have that good paycheck and that status of being a physician in a system. And after 3 systems, I became incredibly disillusioned with what I was in. It felt toxic. I was starting to develop moral injury within 4 years of being post-residency. And something inside of me said, you have to get out or you're going to get cancer. I mean, it was a cancerous system. And I was highly disillusioned because, you know, at 30, I really didn't know the ways of the world, and I didn't really know how to interface with that. But what I saw is that really what was happening is these blind spots were developing in medicine that were very profound and very dark, in which physicians were being asked to cut off from their feeling function in order to serve cash flow. So it became a production line. And if you weren't producing, you were out. If you said anything about the ethics of how you wanted to practice, or the ethics that weren't being practiced, you were out. You were not a quote unquote team player, is what they used to say to me. You need to play on this team. And for me, the team was very toxic and dark. So at one point, I remember saying to myself, I don't care if I have to live under a bridge. I don't care if I have to live in a trailer park. I cannot practice this way. I have to create something that is of value and worth and is sacred to me, that preserves the sanctity of medicine and the doctor-patient relationship. And I don't know what that is. And I was terrified at the time because I had no business background, but I can't work here. And so 3 systems later, that's where I arrived.
I'm so sorry to interrupt, but you mentioned something just a minute ago that I would love to pull on that thread if we could, just for a minute. The words you used were something like the requirement was, in order to qualify as on the team, you had to disconnect a part of yourself. And I don't know quite the words you used, but that's what I was left with. You were seeming that you were saying they were demanding of you, if you're going to play on this team, it needs to look like this. And what that means is some sort of disconnection. Did I hear that right?
Yes. I mean, I think what I said is that you had to disconnect from your feeling function in order to practice like you were part of a production line.
Yeah.
Because there's no way that you can practice medicine from a place of feeling with alignment with your heart and soul and with the vision of medicine as a production line. It's just simply not possible. So you have to endure moral injury. I called this moral injury, you know, disconnecting from your emotional body, from your heart, from feeling function. That is, to me, moral injury. And you had to basically, you know, choose that in order to practice in that system with a big salary and all the bennies that you get. And for me, that was not a good enough measure of my worth and the worth of medicine. I was willing to sacrifice that in order to struggle to create something of value for patients and for healthcare, and something that was sustainable and cost effective. And so one of the visions I had was, if you want to change the world, you start at a grassroots level. You really start with yourself, and you really get down to some basic principles of how am I living my life? What is of value to me? What is of meaning to me? And if you're not living that yourself, you really can't authentically teach it. You can't expect your patients to follow an authentic life that is health and well-being sustaining if you're not practicing it yourself. And there's just something about that struggling to be the outlier, to step out of the stream of the collective shadow, that you have to have the courage or the foolhardiness, naivete, to step out and say, I'm not doing that. I'm going to do it this way. And I don't know how that's gonna happen or where that's gonna lead me, but I know what I can't do. And so in my mid-30s, that's who I was. Had no idea how this was all gonna go and how it was gonna work. But I knew that I could not work in corporate healthcare.
Yeah.
And so I set out to create this center that I call the healthcare model that holds the line against the current corporate system, because I was not willing to sacrifice the scientific method and the evidence-based training that I had at Albert Einstein and College of Medicine and Stanford, and all the board certifications that I had. I was not willing to throw that out. I was not willing to not use science in the right way, in the way that it's meant to keep people safe.
Mm-hmm.
So, I felt there's a way to align with the scientific method and be open-hearted and heart-centered, with, of course, healthy boundaries to protect myself. But that is what, to me, integration is all about. And, we've been on this earth for, who knows, millions of years, and we've been healing each other for all that time. And so there's a wealth of medicine that is non-traditional, alternative, we call it, but it's really not alternative, it's time-tested, that is not being accessed, let alone the way that we view ourselves and our body and discount our body's wisdom. None of this was taught to me, even in the best schools in the country. A lot of it was the rational and the physical aspect of symptom management. I mean, I've got good training in symptom management, but it's really unfulfilling. It's an empty track. Really, what makes my heart beat is to uncover forensically, where is this coming from? Is it coming from an emotional level? Is it coming from a spiritual disconnect? Is the symptom coming from, a trauma or a constitutional imbalance? Or is it coming from just a gateway that a person is in and not able to navigate or access a context that will help them orient themselves in life? Where is the symptom coming from? And so that's what I do with my patients. I explore that. And my practitioners at the Ommani Center are skilled in these various modalities, acupuncture, homeopathy, massage, Reiki, craniosacral therapy, nutrition. So we bring a wealth of this, as well as psychological intervention, to help people really learn and understand how their body works, how it can heal, and how diseases can be prevented and reversed. Not just diseases, but symptoms. Most people don't have diseases. They just have nuisance symptoms like anxiety and depression and, responses from the body that are trying to get their attention. So, and they become a nuisance because that's how our society views this. They don't view it as this is a signal from your body that you need to pay attention to or attend to this aspect of your life that you're not really looking at or that you
Mhm.
need to look at right now. And we just, the collective doesn't have um, any value of self-exploration or self-knowledge.
Right.
So that's
Right.
the insanity. I would translate insanity in medicine to this paradigm that's been put out there that you live your life unconsciously or however you do that gives you pleasure, whether it's exploiting the earth or, of course, a lot of our lifestyles are earth exploiting. Uh, and then when your crisis hits or your symptom hits, we're here for a lot of money to put a cover on it.
Mhm.
It just, that's insane to me. It doesn't make any sense.
Right.
So for me, it's really an issue of um, how can we bring a context to people that requires them to take responsibility for their choices, to even see that their choices matter, and
Mhm.
how to create an environment for your body, for your life, for your mental health, for your emotional, spiritual health that includes you,
Yeah.
where you are actually invested in exploring what you're here for, like what matters to you, what brings you meaning.
Mhm.
Those are some of the things that are central to my mission at the Ommani Center. And it's not woo woo. I mean, I would probably be called woo woo by the traditional medical system, but I think they're insane because
Yeah.
I think that they really need to expand their system to be inclusive of the human experience. That's where all the healing happens.
There's just one quick question I'd like to ask you before we dive in the direction that I spoke of in the introduction of you. that that direction is right into the fray that we're all in, um, particularly with pandemic elements and so on. The quick question I have for you is, could you just give us a sense of how you're doing in terms of the practice, in terms of this vision that you had when you knew it was time to break away from the uh, allopathic medicine machine? Um, is this a functional model for you? Is it working out?
Mhm. Well, I think that what I can say is, the center was developed as a sustainable model. So I did not, I remember my CPA when I first opened the doors said, well, you have to have a strategic plan and you have to like keep increasing your profit as you go. And I said, that doesn't work for me. I'm not interested in that. I want to sustain myself, and that's the end of it. I will create a life that is sustainable for me. How much do I need to make in order to
Mhm.
sustain that life? And if I can do that and support my staff and support my patients, I'm happy. So it's not going to be this runaway profit model. So I basically put a kibosh on that from the very beginning. So given that that's how the finances of the center are structured, and the center has been around now for nearly 21 years. So it is a sustainable business model.
Yeah.
Um, I when COVID hit, it was very interesting because the 3 or 4 months before December 2019, I had a sense that I needed to really hunker down and go on a tight budget and get my rent lowered to match the fair market value because my rent was inflated, and just kind of, hone in the overhead. So I started doing that in December, January of 2020. And then COVID hit in February, March. And a lot of the center, uh, I was in this huge transformation, and a lot of people left the center, a lot of staff left the center, and so new staff came in. It was just a new, refreshing, more vision aligned group of people, but my overhead was reduced significantly. And it's almost like the center itself, or the vision, or the universe, or whatever you want to call that invisible hand, prepared the center for staying afloat while patients were canceling, and there was this tremendous amount of fear and confusion. And so during that time, I decided, I'm not seeing a lot of patients every day, and I had switched over to uh, um, remote consults and follow-ups,
Mhm.
appointments. And I thought, I love to teach, and what better time than now to create a learning platform
Mhm.
where I can share what I know about how the body works and how people can stay healthy in a series of webinars that will help my patients, help the world, help the community understand immunology, understand COVID, understand hormones. How does this all work, so that they can at least have a concept of the importance of conscious choices, the importance of what you put in your mouth matters, and that it affects your immune response, it affects your health in these specific ways. So think about when you eat what you're putting in your body, especially during a pandemic. So I spent hundreds of hours creating this platform. And if anyone's interested, it's rosekumarmd.com. And 13 webinars are on there that basically cover all the topics that I don't believe have been covered by our medical system during this pandemic. So I've been very tired, in a good way. I guess there's a good fatigue, and just expending a lot of heart energy and brain energy trying to create a foundational platform for people to be able to learn how to live better during this pandemic.
Mhm.
And so it's been a series of tweaks, a lot of tweaks that I've had to do to keep the business afloat. And it's getting better. I think people are starting to catch on that they need to learn this. This is a learned skill set
Mhm.
that is not in the water in our society.
Yeah.
Health is still not a value. I mean, you can just look around and you see how unhealthy people are.
Right.
Certainly that is not valued. And so, so I think that those of us that are paradigm shifters, our work is hard right now because
Yeah.
people are hanging on for dear life to the old way of being, which clearly isn't working, but the new way hasn't really quite arrived yet in mass. So we're in this huge transformational process. I think probably the death process right now. The death of the old, the death of people, the death from COVID, the death of old ways of being, the death of our infrastructure, because none of it is working, none of it is sustainable. So, we're here to offer, all of us collectively that are of the new paradigm are here to offer some hope and some actual skills and conversations to inspire people into the new direction they have to go. That's more
Yeah.
sustainable.
Yeah. Well, thank you. Thank you for that historical context, and then, that last piece of, I'm just curious, when someone has such an extraordinary alternative. Sorry, I keep using that word. It's just all I
It's
really
okay.
know. Um, it takes immense courage to do what you've done. And so I'm always curious, how's it going? And you've just answered that beautifully. So thank you. And really, this leads us to the spicy part of the conversation, spicy just because I get a sense you really have no um, reluctance to say it like it is. You have no reluctance to speak truth to power and also to just speak the truth as you see it from your professional point of view, from your personal point of view, as a woman, as a mother, as a business person, as a doctor, a community member, and so on. And again, that's a combination that really got my attention in our chances to speak in the other conversation group that we're in. And particularly, I'd like to step right into the spiciest part of all from my perspective, which is um, really where I have started to perhaps overuse the word insanity, and that's with the COVID stuff going on. Um, I think you were extraordinarily straight up and diplomatic in what you were describing in terms of this is a time of bridging people from the old paradigm and to the new paradigm and so on. And I get that. And 2 years ago, 5 years ago, 10 years ago, I would have said, yeah, that's the bridge and that's where people are. And it's a good faith conversation. I don't, it's very difficult for me to say that this is a good faith conversation anymore. There's a washing through culturally, just waves have washed through us as a culture, particularly in the USA, which have a real possibility of decimating the last few fragments of uh, the word I often use is communitas, that sense of what connects us.
Mhm,
And it seems like there's not much of that available anymore.
mhm,
And so it's not just some I've been that I'm if I'm an average person, which I obviously am, and I'm making this bridging journey from the old paradigm of well-being and how to be responsible for my health and so on into a new paradigm. I'm also saturated in the same stuff that's affecting so many that have governments and corporations and individuals and communities be absolutely cruel and brutal with one another,
mhm,
having tens of thousands, hundreds of thousands of people die that don't need to be dying,
mhm,
and an extraordinary thought process or lack of thought process or default and shadow driven
mhm.
thought process and sense making going on. So you get a sense of where I am
Mhm.
standing with this. And I'm curious if anything I'm saying sparks you in a direction that you'd like to share about.
Well, I think, when COVID first began to show its face in our country, what we were at a threshold of the shadow, the collective shadow being revealed to us. And the political climate for, I'd say, a few decades now has been amping up that shadow. You know, these are elected officials, and these are people who we align with, whether it's right or left. There is a shadow in both. And so I kind of see it as our collective shadow that has come up for us to take a good hard look at. And and the medical system has a shadow, and they're all in bed together. And so what I saw, to my absolute horror, was no focus at all on how people are supposed to be healthy or stay healthy. We heard a lot about comorbidities. Every comorbidity that an American has is lifestyle related, every single one of them. Every single comorbidity an American has, or anyone in the world has, can be reversed through making different choices. There was no focus on that at all. And the other aspect that I was horrified at is, in the school I was trained in, you never really put preliminary information out there for public viewing. And we were just dumping all kinds of preliminary information out there to the public that I think created a lack of trust, because a lot of that information was then withdrawn because it was not peer reviewed. It was not part of a clinical trial. It was just people fear, talking from a place of fear. Well, maybe this will work, maybe that'll work. And so I saw the chaos in the system itself, in the corporate system, that showed its lack of integrity, its lack of heart, the way that physicians were being treated on the front line of COVID, the lack of supplies to keep them safe, the way that billing was being done for COVID. People that were dying with COVID they were signing off that they're dying of COVID. These are corruptions of the system that I think have legitimately caused people to lose their trust and to be heavily confused and to be vaccine hesitant and to not know what to do. So we've got this huge population of people that really have no trust in the medical system. And the system itself, corporate medicine, has earned that lack of trust. So I feel that this process, this pandemic, has revealed to us the dark side of healthcare and how it's operating without heart, without vision, just as a corporate charter, as you call it. It's a corporate charter. It's just continuing to move forward, making lots and lots of cash flow for its own use. And we're all being used by that vision of cash flow. I mean, I don't know how anyone cannot see that. And I think that it requires moral injury of physicians in order to participate in that. This is the old adage of learned helplessness. Hans Selye did the experiment with dogs in a cage, where a dog was put in a cage, the dog was shocked, the dog moved to the right side of the cage, the dog was shocked there, the dog moved to the left side of the cage. Pretty soon the shocks were on both sides of the cage, and the dog became paralyzed and helpless. And even when the cage was open, the dog could not leave the cage. That is the state of a lot of physicians that are employed in healthcare right now. They are in learned helplessness. They want to do the right thing. They're not able to in that system that is cash flow focused, and they don't know what to do. So I think in one sense, I feel that a sustainable business model, requires you to make certain sacrifices to say, what gives me meaning? What is the measure of my life? I don't really think about retirement. Why would you retire from something you love? Why? I mean, I don't want to just, hang out and do nothing and play golf, and which I don't play, or travel. I want to offer something of value to the world. Right. And you'll never want to retire from that. I mean, I love being with my patients. I love watching them heal. I love sharing in their life and in their stories. Mm-hmm. One of my patients, who's a nurse, she's a case manager in a hospital, she was telling me that she's horrified to hear physicians demeaning patients during their case management meetings. And I immediately felt that they kind of in their minds have to do that in order to continue to stay employed by that system. because as I said earlier, you have to cut off your feeling function in order to be part of this corporate system. It's like
Mhm.
it's like the Borg. It's like a big machine that
Mhm.
just churns out patients and physicians. And if you're not a team player in that Borg, you're out.
Right.
So I think more and more that's going to start happening because COVID has amplified, the moral injury in physicians and the burnout in physicians and the way the system is set up. It's not set up to heal, it's set up to make money.
Mhm.
And physicians are the minions of that system.
Right.
So I feel that maybe some good will come out of this shadow time where physicians will start to say, I just can't do this anymore, kind of like I did,
Yeah.
22 years ago. I just couldn't do it. Everything inside of me said, no, I have to take a chance. And what do I have to lose?
Mhm.
Money. Okay, so I'll lose money. So what? Money is fickle. You can make it, you can lose it. It's
Right.
not really the axis of my life. So
Yeah.
when you live from a place of meaning and alignment, and again, ultimately, this is a choice that everyone has to make.
Mhm.
What gives you meaning as a physician? What are you willing to sacrifice? Because life is never without sacrifice. And we have to just embrace that because that is life.
Yeah.
This whole idea of, having a happy life or having a richer status oriented life, these are meaningless pursuits. This is not true value. And so I think that we have to reevaluate what is important.
Right.
How do we want to live? How do we want to die? How do we want to leave something of value to this world? Um, and so I feel that there's this general helplessness in society right now. Patients have it, physicians have it. The only people who are, making it, quote unquote, are the
Yeah.
people running healthcare.
Yeah.
Um,
So actually you just looped back, excuse me, you just looped back to exactly the spot that I wanted to ask to go back to pull on that thread, and that you laid it out beautifully how the uh, frontline uh, healthcare delivery staff from doctors, nurses, and so on all the way down the line, there's a learned helplessness. There's a way that you just need to toe the line. This is how it goes here. You fit in there, or you aren't here.
mhm,
That sort of feeling is what I was gathering that you're describing, and you just now included the patients in that as well. And I just think that's it's interesting. I don't know how much you got to explore in my website, but the core of my body of work is basically what got us into these global predicaments,
mhm,
human caused predicaments, is our collective and individual disconnection from all the primary sources of meaning and relationship in human life, which is really what you've been describing in different ways
mhm,
at every level of this conversation. And what you also described was kind of the punchline of the work that I'm creating, is to create an environment in which people are drawn to reclaiming their center. If we can call that whole process of disconnection losing or forfeiting center, a sense of where am I living from, a seat
mhm,
in which my spirit can, live from,
mhm,
which is, again, just slightly different words, but I think what you were just describing, it's such a deeply heartbreaking
mhm,
scenario.
mhm,
And it is wonderful that you have some amount of that reclaiming of your center on so many levels that you've been sharing with us in creating this center, the medical center that you oversee, and your whole way of approaching your work. I'm wondering if you can just speak on a personal level, because you are on the front lines and you are encountering people who have had their center just ripped out. They have forfeited it, it's gone.
Mhm.
And that implies this kind of extraordinarily delusional sense making in the world. You know, people are not choosing from that kind of centered, grounded, whole being choice point. They're choosing and they're reacting and acting out of having had that center just ripped out, and
Mhm.
continually, you know, as soon as a little bit comes in, it's just no way.
Mhm.
And I'm curious if you could, these are obviously my way of describing the
Mhm.
general
Mhm.
condition. I'm just curious if that sparks you to share what you might have experienced with your own patients, and with you know, at the public at large, what you're
Mhm.
seeing as a healthcare provider. Does this spark you to share anything that you've encountered?
I feel that, the way that I see, I've talked about this in the book that I wrote called Becoming Real, Reclaiming Your Health in Midlife. And what you're sparking in me, Dean, is the theme of this book is about, what we do in the first half of our life is we gather our wounds. We get imprinted, we get downloads from our ancestors, all the stuff that has not been processed by our parents. I mean, we are born into this, and it's by design. I think it's by design. And by the time we hit 45, we have gathered enough suffering that we have material to work with. And we don't have a compass in our Western society. It's just not there. And so that lack of compass means that it's very difficult to reconnect with self, with our center.
Hmm.
And so a lot of people will call this a midlife crisis, or something happens to evoke this movement back to self. So what I tell people is you spend the first half of your life, trying to fit into the world, pleasing the world, and you keep adapting until you get separated from self. And then something, it's intrinsic, it's also external, because you've oriented your life around this adapted self. Uh, Something happens out of awful grace most times, because we don't listen if it's not painful. And even when it's painful, many don't listen because it's not a value to listen and to gain self-knowledge. But when that crisis hits, we have to, it's the call from the self, from the center, that says, turn towards me rather than the world. All the spiritual traditions talk about this. It's that process of individuation that we are called to embark on consciously, sometimes against our will. But when we do it more consciously, it has more meaning. And so I feel that I see a lot of people that are so separated from their self. And what encourages me is younger people are feeling, people in their actually 30s and 40s are feeling that that separation is creating anxiety, or that separation creates depression, or that separation causes sleeplessness, or they'll come in for a symptom like that, and it comes back to how they're separated from their center, how they're separated
Right.
from their self.
Is it
So
is it safe to say that what we're talking about right now, what you're
mhm,
describing right now, it seems like, if I compared it to 10 minutes ago, when you were describing about, you know, the kind of way you and I could have talked about it 5 or 10 years ago,
mhm,
this bridge for the average person to consider that there's a different way that they can take on seeing and engaging with their own healthcare, being responsible for it, being aware at a different level, and so on. That kind of bridge had a certain dimension to it. It had a certain kind of time flow. It might
mhm,
take a few years for a person
mhm,
to come to these realizations, and they may or may not follow it all the way, and
Mhm.
so on. But it seemed like what you're describing right now, and perhaps this is what you talk about in your book, is it seemed like a more accelerated and a more finely tuned attention
Mhm.
to the core of the conversation by this patient that you're talking about, this sample patient that you seem to
Mhm.
be talking about. Is that safe to say that what you're describing in this occasional patient that you're speaking with, they're having a realization, and perhaps you're delivering a certain amount of education or
Mhm.
your presence and so on? Is there an acceleration? Is there a different way that this person is engaging?
I'll answer that in a few way, from a few angles. I don't feel that most people see it as a separation from center. They just come in and say, I have horrible anxiety, I have panic, or I have depression, or I have pain in my stomach, or I have irritable bowel syndrome, or, you name it, any symptom, even hot flashes, sleeplessness. So they'll come in, and then when I take the history and we explore, we go underneath, what does it feel like? Or when does this happen? Or what's the sense of it? Do you feel like you're not safe? Or when did you first experience this? And, what's going on in your life? Well, this is about maybe a 10-minute conversation. We get right to it. And then there's this aha, like, oh my God, it's just all connected. It's all connected to that job that I decided to take. And that job has caused me to basically lose my sense of self. And if fear wasn't an issue, what job would you love to do? I mean, what are you here for?
Mhm.
What gives you joy? What gives you a sense of meaning? And then that's where the conversation goes. And they have a lot of food for thought. And yeah, and I do a food inventory and find out what they're eating and whether they're drinking alcohol, because alcohol is one of the number one causes of anxiety, because it
Mm.
trashes your microbiome in your gut, which supports your nervous system. So people will be drinking in order to quell the anxiety, which causes more anxiety. And it's this vicious cycle. And my point is that the inertia in society to numb and to not attend to the self and to the center of our lives, our center of our beings, is so massive
Mhm.
that people get swept up into the inertia, and they want to belong. So they belong to an unhealthy society that doesn't value self-alignment, that doesn't value um, true value, that doesn't value meaning. So the two things that society is going after right now is status and money. I mean, this is what our core values are, and power. Money gives you power, or
Mhm.
status gives you power. So these are like sort of the the three-part nightmare that we're in right now, that is pulling people towards it due to all the inertia that it has gained over time. And people are feeling that separation, and it's even more amplified during this pandemic. I
Mhm.
think that's the sort of the hidden lesson of this pandemic, is to highlight these shadow aspects of our society so that we can start to wake up. We can start to take inventory of how we're living, how we must live, how we should change our choices, how we should attend to self, how we should seek alignment. It's not something that most people can do on their own, and we're
Right.
back to the communitas. What is the community that can assist you? You have to look for it. You have to want it.
Mhm.
So I feel that if you want it, if you intend it, you do draw in the teachers that can, and the guides that can help you. I certainly have. I mean, when I've, cried out loud that I feel so lost and alone, people show up that help me find my way back. And so I think that you have to have the longing to align and to connect with yourself, to be in love again, to have love in your life and have heart in your life. And people will show up because enough of us are out there. Every time a patient comes into the Ommani Center, I always ask them, how did you hear about this place? And it's always like this synchronistic story of, I read about the center, years ago, and then it keeps coming up for me now, and I'm in this situation, and something inside of me said to make a phone call. This is how my patients come to me. And for me, it's a sacred honor. These are sacred contracts. I mean, we're here together to explore life, to explore these gateways, and to try to move through them as consciously as possible. So, I feel that there is a huge amplification right now because I think we're at a critical point. Climate change is at a critical point. Our health is failing. We have the highest death rate in the world from COVID. I mean, none of this is making sense. I mean, what is going on here? People are fighting with each other. They're divisive. They're not, they've picked an infectious disease to fight over. This is insane. And, we really need to come to some kind of a ground where we care about one another again, where we care about what's important, what's eternal, what is not transient, like money and power and status. Those are just all impermanent projections of our mind. And we know that that's never worked. If you go to, I'm from India, and if you go to a slum in India and you look at how happy people are with nothing, there's a certain level of value that comes from not being materially oriented. There's a certain level of grace and heart alignment, because I personally think that too much stuff is a distraction. We really need to, come back to the simple ground of our being, and that has me and doing what I can to keep my community healthy and aligned with meaning.
Yeah. Dr. Rose Kumar, it has been just shockingly aligned to speak with you. I had no idea it would be this much alignment and overlap or resonance. This especially this last few minutes when you're speaking about each of us in our own language, speaking about this return to center, that what we're facing right now is the human caused collapse of Earth and human systems that's primarily caused from our disconnection from the web of life itself, from deeper self, from other people, from Earth herself and soul. And it seems like, again, in both of us in our different languages, speaking about how we have set up an offering. Each of us offers different elements to the people we care about, and offering an environment in which it is attractive to return or reclaim center. And so it's very moving for me and very inspiring that we've come to this place where we seem to be so close in what I would call this conversational neighborhood, like where the corner where you usually hang out and the corner that I usually hang out, we're really close.
Very close, yes.
Really close.
So inspiring for me, Dean, that you exist, you're here, you've been working at it and serving it for so long. I mean, this is a life's work for both of us. I mean, we're serving the same wholeness, I feel. I do have a webinar about COVID and transformation, if anyone's interested, to orient themselves in the transformational process and what is a transformational process and where is COVID in that process. I did it because I created this because I thought it would be very helpful to people, but a part of me was skeptical and thought, no one's going to really want to know about this. I mean, this is a different language. But people were watching that webinar and weeping. I mean, they send me the most beautiful feedback about how they feel like they're not lost in this pandemic, that they
Mhm.
feel like they have a place, they know what their place is as this is raging on.
Yeah,
And, and that's, I think it's important for us to offer the transformational context and to really stay
yeah,
connected
yeah,
in heart and in integrity as the world is transforming.
yeah. Again, just so much resonance. This whole notion of the transformative, there's kind of a three-tiered dynamic or placement in my, person will self-assess themselves into one of the three levels of engagement in this work. And the first one is first aid level, to just be able to co-regulate, to self-regulate, and at the most basic level to be as present as possible to be able to live life, take care of our loved ones, and so on. The second level is this way of taking on practices of reconnection, and that takes some time. It takes some sweat equity to really earn it back, bring back that center. And that third level is the transformative. And I'm really looking forward. I can't wait to sign up and do your webinar. And of course, I'm happy to post the way people can contact you and your work and this webinar that you're describing. It couldn't be a better fit. It's just extraordinary again. So I hate to say it, but we're done. We've hit the end of our time. I really look forward to whenever we can find an excuse to do another round of this conversation. I think it's extraordinarily nourishing in a time of when, as a culture, we're starving
Mhm.
for this kind of insight and this kind of orienting ourselves back to our own centers. I'm just so, I don't mean this in any kind of condescending way. I mean it as sincerely. I'm just so proud of you. I'm so deeply,
Thank you.
sincerely appreciative of what you've created at a time now when it's just vividly clear how much we need that shift in our own well-being. And so thank you for what you do. And I just so look forward to our next time when we get to connect at the next level. Thank
Thank you
you.
so much, Dean. Thank you.
Thanks for watching another episode of the Poetry of Predicament podcast, produced by Dean Walker and the Living Resilience Alliance, www.livingresilience.net. Music today from Michael Hedges, as always, and also quote, Blew into the Sea. Also available on our website, www.livingresilience.net, is a wide array of articles, online learning series, arranging group and individual resilience coaching, and sign up for our every other Tuesday free support group that we call Safe Circle Calls.